I wanted to, first of all, my thanks to the staff that are on here in the panel this evening, and also to all the parents that have joined us. I see right now we have over 70 people that have joined us, and thank you very much for taking time out to do this. One of the things I just wanted to share with everyone is that, you know, this is certainly interesting times for everyone. It's interesting times for families, for our students, and for our school districts. And we're going to share this evening the actions that we have taken to date to get ready for the reopening of Broome-Tioga BOCES. And it's our desire to make the environment the safest possible for both your children and all of our staff. I do want to say that we're going to continue to need your help in the families with helping with the behaviors of the children, and as we work with our staff, so that we continue to focus on personal hygiene items in terms of masks and washing hands and all those types of things. Because one of the things that I think we've learned through this process is that, you know, we can make the buildings clean and we can wipe down surfaces, but at the end of the day, it's all going to be up to us and our individual behaviors to provide the best possible environment. I wish I could say to everyone that I can guarantee you everything's going to go great and everything's going to be fine. I can't do that, but I can tell you that there is a group of hardworking people that have done a lot of work and their very best to make this transition back into the classroom as smooth as possible. And with that, I think I will turn it over to Marie for introduction of the panelists, as well as getting our slideshow started. Thank you.
Thank you, Mr. Bike. And we'd also like to thank all of our parent and guardians of our Broome-Tioga BOCES students for participating in our special education reopening webinar that our team has worked hard to provide here for our audience this afternoon. And so we do thank you for joining in and logging in with us. Just as a reminder, our Q&A function is up and running. So parents, guardians, please feel free to enter in any questions or concerns that you may have, and we will be sure to answer your questions as quickly as possible. I'd like to move forward and introduce the panelists that will be participating and presenting out for our forum this afternoon. We have Mr. Al Bike here with us, who is our district superintendent. My name is Marie Mahar. I am the Director of Special Education for Broome-Tioga BOCES. Also with us this afternoon, we have Mrs. Rebecca Falink, the Principal of PALS, Eileen Monaco, Principal for Oak Tree. We have Mrs. Maria Kiesler, Principal for the West Learning Center, Mr. Matt Saliga, who is our Assistant Principal for the East Learning Center. Miss Tammy Eves is here representing Related Services. She is our supervisor for Related Services. And last but certainly not least, we're very happy to welcome Mrs. Marissa Knapp with us this afternoon. She is our assigned liaison from the Broome County Health Department. Thank you for being here, Marissa. This is our agenda for our presentation this afternoon, walking through step by step the topics that we intend to present out for all of you today. We are going to be covering today our reopening plan by sharing information of our schedules by program. Secondly, we have a presentation from Mrs. Marissa Knapp, who is our liaison from Broome County Health Department, as I had mentioned. We are also going to cover in-depth topics including staff and student health, our building cleaning protocols, building access, PPE protocols, which will include face coverings, and also our social distancing protocols across school settings. Our norms for today include the fact that we are here in a webinar format. And as I had previously stated, we welcome you to put all of your questions into our Q&A section. We do have members of our team that are working very hard this afternoon to answer those questions as they come. So we are going to work as quickly as possible for you. We also have a chat feature, but that will not be available for this webinar this afternoon. So as I mentioned, please utilize the Q&A section as questions arise. With that, I'd like to move forward with our reopening plan and cover for our families today what our schedules will be for our programs. And I would like to start with this slide here that includes our programs that will be open 5 days a week for in-person instruction. And as you can see here on the slide, that includes our center-based PALS, Project Search, and Oak Tree programs located here at the Ed Center. At our West Learning Center site, our Reclaim and Crossroads programs will also be open for 5 days in-person instruction. At the East Learning Center location, our Crossroads program will be open 5 days a week. And our Adolescent Day Treatment program will also be open for 5 days a week in-person instruction. For our district-based programs, our Harpersville site for Crossroads will be open 5 days a week for in-person instruction. At our Union Endicott sites for the Crossroads program, we will be open 4 days a week for in-person instruction. We will be remote on Wednesdays. At our Windsor sites for our Oak Tree programming, we will be open 5 days a week for in-person instruction. At our Vestal sites for our Oak Tree program, we will be open 4 days a week with remote instruction on Wednesdays. Before moving on to the next slide, I wanted to bring to the attention of our parent and guardians some important information regarding all of our programs. Just wanting to make you aware that we are open here at Broome-Tioga BOCES for the schedules that I just reviewed for our programs. But it's important to note that as a parent or guardian, you have the right to request that your child receive their instruction and their services in either a remote or a hybrid model of your choice. And it's important for us to share with you that we will honor your parental request here at BOCES. Also, as a parent, you also have the right to change your mind regarding the initial selection that you made as a parent. So for instance, if you elect as a parent of one of our students to start your child in a remote learning model, you do have the right as a parent at any point to change your mind, and we will shift in accordance with your desires. So if you should decide after a time period that you would like your child to return for in-person instruction, we will honor that. I'd also now like to move forward with the related services section of our reopening plan. So for our students who receive related services, including speech, occupational, and physical therapy, all of our therapies will be provided in person. And that also includes our learners whose family elects for them to participate in remote learning. We will provide in-person therapies for them as well. For students that are choosing the remote or hybrid option, we will also be providing related services in the mode of teletherapy and or through materials coordinated with our families for those students on a case-by-case basis. I'd now like to move on to our presentation from Mrs. Marissa Knapp from the Broome County Health Department. Marissa?
Hi, good afternoon, everyone. Can you hear me okay? Okay. Hi, my name is Marissa Knapp. I am a public health educator for the Broome County Health Department, and I have been helping with the COVID-19 response since March. So I am your school liaison, and I am here to help all of you with anything that you need. That means questions. That means when we have a case investigation, I'll be the one doing the case investigation. If I can't do that, another one of my colleagues will. COVID-19 may be new to all of us, but contact tracing and case investigation is a practice of public health for decades. So it's something that we do with other communicable diseases. And if you are a student, if you're a teacher, or if you're just a community member out in our community, we treat you all the same as far as a case investigation goes. So what would happen in this situation is we receive a positive test result that goes into our system that gets sent to us by the hospital systems or the labs. And then as soon as we get that, within a couple hours, we are in touch with the positive case. So that is what starts a case investigation. From there, we get a full list of contact tracing. So that means if we're sent someone who's positive, we are finding out what their activities are either 48 hours prior to their first symptom or 48 hours prior to their COVID-19 swab. This is what we call a case investigation and contact tracing. So let me give you the example of if your child is in Mrs. Smith's class and Mrs. Smith tests positive for COVID-19, all of the students in her class would be put on a 14-day quarantine from the last day of contact with Mrs. Smith. Mrs. Smith herself would be put in what we call an isolation. So the difference between isolation and quarantine is isolation is the term we use for the person who tests positive, and quarantine is the term that we use for anyone that was a close contact. So let's say, for example, Mrs. Smith at home has a family that she lives with. Anyone in Mrs. Smith's family would also be quarantined because they were in close contact with her. But let's say that Mr. Bike was in Mrs. Smith's class. Mr. Bike would be on quarantine, but anyone in his family, that's what we would call a contact of a contact, they wouldn't have to do anything different. So we get that question a lot. So because Mr. Bike had that contact with Mrs. Smith, he would be the one that's in quarantine. Anyone else in his family, any of his friends that are around him, they don't need to do anything different unless, of course, he ends up having symptoms or test positive. And so part of our investigation, we explain that, to the person. Now, in this case, we would be reaching out to the parents, most likely, and this is where we, of course, always respect your confidentiality, but in cases where we're working with the school, we're going to need to reach out to the school to get all of the contact information in a certain class. So parents' names, phone numbers, guardians' names to reach out to them. But we just want to assure you that we always have to follow HIPAA and confidentiality. So we would never post on the BOCES website that, there was a student in Mrs. Smith's class that tested positive and this is their name. So we never would name that person. And when we do a case investigation, we do everything we can to, protect your personal health information. So symptoms for COVID-19 can really range for a variety. I think we all are aware of the respiratory symptoms, but also there can be symptoms of a runny nose, a headache, nausea, vomiting, diarrhea, loss of taste or smell. So that's what we're here for, to help, help you determine if your child, if your child's sick in the morning, we obviously would encourage you to reach out to their healthcare provider. We at the health department aren't healthcare providers, but we would be able to get you in touch either with your child's pediatrician, a specialist, a primary care doctor, or if you don't have one of those for your child, we're lucky that we have several walk-ins in the area that right now are virtual. So we would definitely encourage you to reach out to them. Additionally, there's a range of testing sites available in our community. If you are someone that wants to get tested but don't have a symptom and don't have a primary care doctor, Binghamton University is a great resource. So we are going to make sure the schools are provided with all of the information on testing sites. And so that's what I'm here for too. You don't have to navigate this alone. We do work 7 days a week. So if something happens on a Friday or over the weekend, we don't want anyone to worry that it's just going to sit there till Monday. We are working 7 days a week. We work into the evening, and we are always on top of reaching out. By the end of the day, any cases that are pending, we reach out to the case, and we are constantly in contact. So anyone that's in quarantine or in isolation, we are in touch with them every single day. We're making sure that someone is ready to be released back to school, and if they don't meet that criteria, we do not release them back. So that's always a question. Sometimes people worry, well, this person, you know, was issued a quarantine, but now they have symptoms. How do I know they're not going to go back to school? We always provide documentation that releases that person back to school or back to the community, whatever the situation may be. When we do a case investigation, what we consider close contact is anyone who is 6 feet or closer for 10 minutes or more with or without the mask. So we know that masks definitely help slow the spread and can prevent, especially someone who's asymptomatic. So someone who doesn't have symptoms is wearing a mask, that prevents them from spreading the virus. But when it comes to close contact, it can lower the transmission, but we have to determine you know, who would be that close contact if it's 10 minutes or more, 6 feet or closer. We also know that the virus is spread from particles. So one person being in close contact with another one, and those particles of talking, sneezing, laughing, going into another person's nasal passages or mouth. It is not a very hardy virus and cannot live on surfaces for very long. So a lot of times we'll get questions about, you know, do I need to have my child, you know, change when they come home from work or shower immediately? We feel strongly that that is not necessary, but if it's something that makes you feel good and, you know, you feel like since your child's going to be at school around other people, if that's a practice you want to take, we will support you in whatever you want to do during these times to make you feel better. But we do know that that's why masks are so important, because of it being spread particle to particle. If anyone has tests pending, so if for some reason you or a member in your family, your child got tested, maybe because they have symptoms, maybe because they were in close contact to someone with COVID, and you have those test results pending, that's where we really strongly ask you to stay home, keep your child home, because once that child you know, is waiting for those results, goes back out to school or in the community, and then they test positive, that then makes our job as contact tracers a little more difficult because the amount of people that that person may have been exposed to. So you guys as parents definitely know your kids better than anyone. So we're just asking you in this time right now, you know, to really be tuned into, you know, every day. Are they sleeping more? Are they complaining of a headache? Are you noticing their behaviors, you know, a little different? And if you can answer yes, then we really would encourage you to reach out to the primary care provider or pediatrician and talk to them about, you know, what they feel should they get tested and what next steps should be. So I'm not sure if anyone has any questions for me yet, or we'll get to the questions later, but I'm gonna share my contact information. So maybe we can put that in the chat box. Are the families able to see the chat box? No? Okay.
No.
I'm just going to share my contact information with anyone. So my phone number at the health department is 607-778-2812. And my phone number on my cell phone, you can text me if you're more comfortable asking a question, 607-288-3278. If anyone, you know, hangs up and has a question, there's no silly question. We are all learning. We're all going through this together. So please reach out if anything is confusing to you or you need more clarification.
Thank you very much, Marissa, for all of your valuable information. We certainly appreciate your partnership through these very difficult times. So thank you.
Good afternoon, everybody. I'm going to speak a little bit on the topic of student and staff health. We understand that we at BOCES, we definitely work with some of the medically vulnerable and high-risk students and staff. So BOCES is committed to accommodate the needs of students who are in high-risk groups of COVID-19 infection, the needs of students who have family members who are in high-risk groups, and also to support our staff. If you as a parent feel as though your child needs an accommodation, you will need to work with your family's healthcare provider to provide documentation for that, and we can work with you to make an informed decision as to best meet your child's needs so that they can be successful in school. If you choose not to send your child back to BOCES in person at this time, we absolutely are committed to providing you instruction remotely, as long as your home school district is contracted with us for our services. We will provide accommodations for our staff within the high-risk group of COVID-19 infection, and we will definitely work to maintain the accordance to the federal and state anti-discrimination laws. We have developed a protocol to instruct our staff to observe for signs of illness in both students and one another. See, some of these symptoms include a temperature over 100 degrees, coughing, shortness of breath, difficulty breathing, a sore throat, congestion, a runny nose, nausea or vomiting, diarrhea, or a loss of taste and smell. Students or staff with symptoms will be sent to our health office, and ill students and staff will be assessed by our school nurse. We have, at the Ed Center, we have RNs and LPNs on our staff or our medical director. If a school nurse or medical director isn't available, the staff will be, or student will be sent home for a follow-up with their healthcare provider. The school nurse and the medical director will assess the individuals for chronic conditions like asthma or allergies or some sort of gastrointestinal condition that might look like COVID, but really isn't contagious or poses a public health threat. We, as BOCES, will isolate and dismiss students and staff members when they have the symptoms of COVID that can't be explained by a chronic health condition so that they can be followed up with their health care provider. Students and staff with a temperature or signs of illness, positive response to the screening process will be sent directly to an isolation area where students are supervised, and then they are either picked up by their family or otherwise transported home. Our school health professionals will wear PPE at all times, especially when assessing ill persons or conducting any sort of respiratory treatment. Our administration has designated 2 rooms at the Ed Center for health service personnel, and we work with our component districts to make sure that there are places at our satellite sites as well. 1 room will be for healthy students to get medication or any routine nursing treatments, and then the second one is for isolating ill persons. In the education center, these rooms are very close together, but they have separate entrances as well. Parents and staff members will be provided resources to help you understand the careful observation of the symptoms so that you can perform the health screening to be conducted each morning before your child comes to school. Parents and school staff will also be instructed that any student or staff member of a fever of over 100 and or symptoms of possible COVID-19 should not really be present in school. We as BOCES have ensured daily screenings, including temperature checks for students, staff, visitors, contractors, and guests. And the process is as follows. If the student is arriving through district transportation, they will be temperature screened in accordance with the school district's process before they get to BOCES. The students who walk or drive or are transported by their family, they will complete the online screening and the temperature check questionnaire at home prior to arriving at school. If you don't have internet at home, don't worry about that. Students will be provided with hard copies of the questionnaire to fill out upon arrival at a designated location at each site. Our employees also must complete an online questionnaire and temperature check questionnaire before entering any of our sites and buildings. If they don't have access to the online tool, they too will be provided a hard copy. Visitors, such as vendors and contractors, will also fill out an online screening and temperature check questionnaire before coming to our building, and they will enter through the main entrance. Hard copies of this are available for them as well. Parents and guardians will enter the building by appointment only after completing the online screening and temperature check questionnaire. Parents and guardians will also be required to fill out a paper screening and temperature check questionnaire before entering through the main entrance. The screening and temperature check questionnaire determines whether the individual has experienced symptoms of COVID-19, including a temperature of greater than 100 degrees Fahrenheit in the past 14 days. If you've had a known positive COVID-19 test within the last 14 days, or if you've knowingly been in close or proximate contact in the past 14 days with anyone who has a confirmed case of COVID-19 or even a suspected case of COVID-19. And lastly, it also verifies if someone has traveled from the state on the quarantine list provided by the state of New York. Thank you.
Good afternoon, everyone. I'm Eileen Monaco, and I'm going to go over our building hygiene. So the first thing we're going to start with is our ventilation system. Our building's ventilation systems have been assessed and updated where applicable to maintain proper levels of airflow and circulation. So for example, we have replaced filters, and that will continue to happen on a schedule. The next area is our disinfectants. We will only be using state-approved disinfectants and materials, and only those approved by the New York State Education Department of Health. Then the next area is our cleaning protocols. We've worked very closely with our operations and maintenance staff to maintain a process to make sure all of our high-touch surfaces are cleaned thoroughly. And so that includes, bathrooms, hallways, entrances, anything that you can think of that is a high-touch surface, doorknobs, light switches. They'll be using, the disinfectants that are approved to clean all of those areas. We've also installed a lot of touchless paper towel dispensers and touchless faucets. There's also going to be hand sanitizer stations throughout the facilities. And then our cleaning staff, when they go through and they do our cleaning and disinfecting, they have a log that they're going to keep that says exactly what has been cleaned, when it was cleaned, and then that information will be shared with the individuals in that area. And then in addition to our regular daily cleaning that we do to the building all the time, there's going to be a deep clean that is done each night by our second and third shift cleaners. And then they move on to the outdoor surfaces because there's also high touched areas outside as well. And those will be cleaned on a regular basis as well. So in terms of building hygiene, we have lots of cleaning and it's really important.
Hello, everyone. I'm Maria Kiesler. I'm out at the West Learning Center, and I'm going to talk about essential visitors. So BOCES will ensure that all visitors adhere to the COVID-19 procedures and protocols and will limit visitors to our buildings to the essential visitors. So essential visitors are people such as agency service providers like Catholic Charities, DSS, probation, Access VR, that's just to name a few, emergency service responders and first responders, food deliveries, maintenance and repair services, substitute teachers, district personnel, so from our component districts, mail delivery, and all of the people that are entering the buildings will be required to complete that COVID screening tool that is available either online or via paper at the entrances to each of our buildings. Parents and guardians will also be permitted in the buildings by appointment only with the respective building. So simply contact the building where your student attends and you can set up an appointment with administration or one of the secretaries in the offices there.
Hi everyone, my name is Matt Saliga. I work at the East Learning Center and I'm going to talk about face coverings. Face coverings are meant to protect other people in case the wearer is unknowingly infected but does not have symptoms. All individuals in BOCES facilities and on BOCES grounds must be prepared to put on a face covering if another person unexpectedly cannot socially distance. All students, staff, parents and guardians and visitors must wear cloth face coverings in these situations whenever they're within 6 feet of someone, in the hallways, in common areas such as entrances, exits, lobbies, also when traveling around the school, in restrooms, and in other congregate settings, including buses. Students who aren't able to tolerate a face covering due to a medical condition will require documentation from a physician. BOCES administration will make decisions regarding students who cannot tolerate face coverings due to a mental health concern or a developmental disability on a case-by-case basis. BOCES will collaborate with the home school district, which may include convening a CSE meeting to amend the IEP. BOCES will provide an acceptable face covering to employees and students and have an adequate supply in case of need for replacement. BOCES will allow an employee to wear their own acceptable face covering. Employees with healthcare provider documentation stating they are not medically able to tolerate face coverings will not be required to do so. BOCES staff members such as aides, monitors, nurses will be provided with additional PPE equipment in order to maintain optimal safety when performing their job duties. Additional PPE equipment will include gloves, face shields, eye goggles, and disposable gowns as applicable. Our students will be provided with ongoing support and instruction around mask wearing both before the start of the school year and when we begin in the fall. Our programs will be sending home transitional support materials and the welcome packets to each family that includes items such as social stories, pictures of staff with and without PPE equipment, etc., to assist with the transition back to school. Also built into the school day will be opportunities for students to safely take a mask break as determined on a case-by-case basis.
Sorry. Hi everyone, I'm Tammy Eves. I'm the supervisor for related services, and I'm going to talk for a minute about social distancing. So in BOCES, we will be practicing social distancing of 6 feet whenever possible, and that will include our building and our grounds. Some of the other actions that we're looking at taking to promote social distances is ensuring that the students' groupings are static by keeping the same groups together whenever possible. We are going to establish designated areas for student drop-off and pickups, limiting contact and entry of parents, guardians, and visitors into the building to the greatest extent possible. We're going to reduce in-school movement where possible by keeping students within a defined area and modifying their class schedules and transitions. And we'll also be ensuring that the distance of 12 feet in all directions are maintained for the individuals participating in required activities that require projecting your voice, such as singing or playing a wind instrument or aerobic activities. BOCES is doing signage in all of the facilities that will be used to promote social distancing, guiding directions and traffic in the hallways and at our entrances and exits, cafeteria spaces, and classrooms and office spaces. We've put a lot of significant preparation efforts into completing for our center-based and district-based classrooms, ensuring that they are all in compliance with the public health and the New York State Ed Department guidelines for social distancing. All of our classrooms and related service areas have been measured and set up to meet the 50-foot diameter space for each person in a special ed classroom. BOCES has moved classrooms and repurposed classroom spaces in order to meet the requirements and to ultimately ensure that we can open to service our students 5 days a week. BOCES will provide training for our staff and our students on social distancing. And BOCES will also be working on altering our schedules for lunch blocks, specials, therapies, and emergency fire drills throughout the school day to ensure that we can maintain social distancing and compliance for all of our programs.
Thank you, fellow panelists, for your reporting out on this important information to our parents and guardians. And now we would like to hear from any questions that the Q&A team members have not been able to answer at this point.
Marissa had a bunch of questions, right?
Hi, this is Vanessa. I'm participating without the mic. I've been monitoring the chat with a group behind the scenes. Let's start with, we've had several questions along the lines of determining what the difference between COVID is and the flu. So questions directed toward Marissa would include, if my son has runny nose, no fever, can I send him in that day? Marissa,
Sure, this is Marissa. Yes, I can answer. So I think the most important thing with going into this school year is that if your child has any symptoms, I know it was just gone over, I mentioned some COVID symptoms are very, very broad. At first we thought they were more respiratory, but we now know when we do an interview with someone, we are asking runny nose, congestion, nausea, vomiting, diarrhea, a headache, a sore throat, loss of taste and smell, a fever, chills. So with that said, it definitely, it might be a challenge, because if you have a child who is displaying any of those symptoms, we would ask that you keep your child home and reach out to their medical provider. So in this case, if a child just has a runny nose, we would have you seek out either their pediatrician, or if you don't have a pediatrician, or feel more comfortable doing the walk-in, the virtual walk-ins are available. But because of COVID symptoms being so broad and because of the threat of transmission, we would just request that you reach out to your healthcare provider, your child's healthcare provider.
Thanks, Marissa. Another question that I believe you could answer has to do with testing. The question reads, if I have a test pending because I am required to test for my job, will my child be required to stay at home?
Yeah, so there's definitely, this is a great question. There's definitely people in our communities that because of their employer, they have to get tested weekly. So in a case like that, we understand that happens, and this is going to be a situation where you have a test pending every week because you're getting tested every week. In a case like this, no. Now, of course, that answer would change if you had symptoms and then your child got tested and there's reason that you wanted to get them tested and you're waiting for a pending result. But in the case where it's a parent or someone in the home who is getting that weekly test for their job, it's a requirement, we would never expect you, while those type of tests are pending, to keep your child home.
Thank you so much, Marissa. Our next questions go along the lines of mask wearing. So I will start with, if a child cannot wear a mask due to medical reasons, will they be separated from other kids?
So I think I could jump in. So in the event that the student is not able to, wear the mask, the staff would work to ensure that the 6-foot social distancing is maintained for that student in order to keep both themselves and their fellow classmates as safe as possible under these conditions.
Thank you. The next question is in regards to masks and if we will be providing documentation for the student to take to the pediatrician if they're unable to wear a mask, or what documentation needs to be in place if they're unable to take a mask off.
I'm sorry, if they're not able to remove their mask?
So the question is, what documentation do you need if the child cannot wear a mask or if they are unable to take it off?
Documentation from their medical provider stating as such would be received by us and accepted under those conditions.
And then the follow-up clarification would be, is the school providing a form for the families to take to the pediatrician?
No, we do not currently have such a form in place.
That question has been asked in a previous session, and we're exploring whether that makes sense for us to provide that, but Marie is right. As of right now, it would simply be a note of some sort from the medical professional. If we do develop a form of such, we'll make sure that that information gets out. I did want to just add one quick thing about this for those families who have children that have legitimate reasons where they cannot wear a mask. As that information comes in, it's going to be important that we get that information as soon as we can, because we may have to make adjustments for our own staff. That in case of a related service staff member or someone else who typically is in close proximity with students and needs to be in close proximity with students, we want to make sure that we provide them the adequate additional protective equipment. So as you become aware of your student not being able to wear a mask and for medical or mental health reasons, please let us know that so we can make those adjustments. Thank you.
Thank you. We have a few more questions to address. Some of them are going back to asking for clarification on the cold and flu season. So one of them is, what if my child gets upset in school and starts to cry and has a runny nose from the crying? What happens then?
This is Marissa. I can just start answering and then I'll have someone from the school. So we completely understand this is going to be so different this school year, and especially, parents who have a child with special needs. So this is a case where we would look to that teacher and the adults that are in the room with that student all day, and they would do an assessment of they're with the child. They knew that they didn't have that runny nose earlier. I mean, I'm a person, when I cry, I ugly cry. I look terrible for an hour, and some of us are just like that. So this is where, of course, we'd be understanding, and I'm sure the school will support this, that this is where the teacher would know, they were assessed in the morning. If it was a situation where they started crying, we would never expect a child, to be sent to the nurse because, they were emotional over something.
Thank you. And another question had to do with allergies. They know that their child has allergies, and is there additional documentation that needs to be provided stating those pieces for symptoms that look like?
So I can just tell you, because I do case investigations, many symptoms of allergies are definitely COVID symptoms. I've talked to people all summer with our ever-changing weather that, thought they had allergies. So I do know that allergies, are common signs of allergies are definitely symptoms of COVID. Now, with that said, if a child, is sick or, has to leave school because they were sent to the nurse's office and assessment was done, for them to return back to school, there's one of three options that's available. So the first would be a note from a doctor, diagnosing that child with something other than COVID-19 and saying that, they have allergies, they have strep throat, an ear infection, and that they are safe to return to school. Kind of similar when, a child is out and they're missing school for a certain amount of days, you get a doctor's note. So in this case, a doctor's note would be one reason that would allow a child back to school. The second would be a negative COVID test. So this is a negative COVID test. The parent went and got the child tested, and they, can report that they do not have COVID-19. And then the third item would be a 14-day quarantine. So we know that there's some cases where it might not be feasible for a child to get tested. A parent doesn't want them to get tested. They're not going to go to their healthcare provider. We understand that might not be an option for everyone. So that would then be a 14-day quarantine. So this is also the case of a child that hasn't been in quarantine, wasn't a close contact. I just want to make sure that's clear, because if a child is placed in quarantine because they were a close contact of someone who tested positive, they have to do that 14-day quarantine even if they have a negative COVID test that they can produce, because we know it can take anywhere from 2 to 14 days for the virus to present symptoms. So that negative COVID test that's allowed in this case would be that case where, your doctor thinks that your child has allergies. They say, you know what, we're just going to have them tested to be sure. You have that negative COVID test, and then they can return back to school. So this is where we'd really encourage families to reach out to their child's provider.
Thanks, Marissa. We're going to change topics slightly, and we're going to go into some of the cleaning questions that parents have been asking. So one of the questions is, what type of disinfectants will be used? Are they strong chemicals or are they plant-based?
I don't know the specific chemistry. I do know that the state education department is very restrictive in terms of what we can actually use. And in fact, we were provided the actual disinfectant that will be effective on COVID, but also not dangerous to humans in terms of children. We could get that information and provide that to people at a later date. I don't know the actual chemical. I do know that up until recently, we were not even allowed in a school setting to have hand sanitizers in hallway dispensers, and we have asked and gotten permission to allow for that to happen. So if there's a specific concern or allergy or something that this individual would like to share with us at a later time, we can follow up and get you the exact names of the chemicals that are being used.
Thank you, Mr. Reich. Our next question has to do with what remote and hybrid will look like. So specifically, when will remote learning days, what will the remote learning day schedule look like? Will there be daily Zooms if someone wants to speak to that.
So I can speak to that. So our team had met very recently to outline best practices for providing remote learning instruction in our NYSA classrooms, which include the Oak Tree and the PALS program specifically. And what we had determined is that we are going to provide remote learning along the same schedule that a student would have should they be in person. And reason being is that we want to ensure the greatest degree of equity for our students in terms of what they are receiving for their services and direct instruction, irregardless of whether they're here with us in person or if they are choosing the remote learning option. So the daily schedule would mimic what they would have should they be here with us in person. And that includes blocks of learning that would be live Zoom for their morning meetings and social emotional learning curriculum, community building in their classroom. There would also be dedicated ELA and math instructional blocks provided under the remote learning model. And also important components for life skills instruction as well, which is a mandated curriculum delivery from our NYSA programs. And so we really worked hard to develop those block schedules to make sure that there is equity for all of our students and that there is a similar schedule irregardless of where they attend.
Thank you, Marie. So one of the questions is asking for the difference between hybrid and remote, and specifically with the hybrid question, who determines what days the student goes in person?
Mm-hmm. So that would really be a determination of the parent or guardian. So as we had stated at the start of our presentation today, our programs are open 5 days a week for in-person instruction, with the exception of a few of the district-based programs that were previously mentioned, including both our Vestal and our Union Endicott sites. So for us here, we are open and happy to take students on those schedules. If a parent opts to choose a hybrid model, they can choose the days that they would elect to have their child attend in person and the days that they would elect to have them participate in remote instruction. Of course, there would be important planning and collaboration between the family, the BOCES administrative staff, and also their home districts to coordinate transportation so that there is a set schedule. But that would be a parental choice.
Thank you. As we transition our questions to more of the in-person instruction, the first question to address is, what will the drop-off process look like, and will I be allowed to take my child to their classroom?
So I can speak to that. There will be designated drop-off and entrances for each respective program. We have expanded the entrances that we'll be utilizing here at the Education Center in order to have a timely and efficient way for students to enter our building, and also to minimize any potential crowding of entrance areas that would not allow for proper social distancing that is required. So we will have those isolated and dedicated areas for students to enter, and that information will be shared in your welcome letter from your respective principals. Parents will be allowed in the building by appointment only under these conditions, as we had stated in our presentation. So our staff and associated paraprofessionals will be available and on hand to safely escort our students to their classroom locations.
Great. So the next question has to do with our plexiglass, and it has to do with, on the point of room configuration, will students be separated by plexiglass along with maintaining distance?
So we have taken a great deal of time to measure the square footage of all of our classrooms and arrange the desks and seating areas so that we've maintained the 50 square foot diameter per person that is required from our state education department. The social distancing and spacing of those seating areas are already going to be in place as we're mandated to make sure that we are in compliance. We have been working with our O&M staff to purchase the plexiglass shield dividers for our students. And we have to date ordered a few batches of those. They have not yet arrived, but we are working diligently with the manufacturers for those purchases and supply arrivals.
Thank you. The next piece, the way it's worded has to do with, is wearing a clear mask acceptable? Can we talk about a clear mask and a face shield, and which of those pieces are acceptable or what we are trying to for?
I think
So
the question might be, is a clear shield for a student going to be acceptable as opposed to a mask? I think that's what the question might be.
So Marissa, you could certainly enter in any information you may have as well, but from what our understanding of the guidance is that a face shield alone is not considered sufficient in preventing the spread of COVID. So face coverings such as a mask are required, and a face shield can be used in addition to a mask, but not as a standalone.
Yes, that is correct. Also from the Department of Health guidance, that just because a face shield has that like room below it, especially if you're thinking about like in a classroom, sometimes like I'm gonna use the teacher example, teachers or aides being above a student, that leaves a lot of room, below. So with that said too, if people have access to N95s and you have students that'll wear them, they can also wear an N95 with like a cloth mask or paper mask over it. But yeah, as far as just a face shield, that is not enough protection.
Just a few more follow-up questions. Returning, Marie, you started to speak on this about staffing when you talked about square footage in rooms. The question is what will happen for students that require an aide if the room is at capacity? How will programs support students and staffing?
That's a great question, Vanessa. So to clarify that for our parent and guardian audience today, when I spoke of the measurement of all of our classrooms and the 50-foot diameter, that took into account not only the students on that class list, but all staff members that are assigned to that classroom as well, which includes the classroom teacher, of course, and all paraprofessionals that are assigned to those individual students. So we built those room capacities with the total class list, students and staff in mind.
Vanessa, you're muted.
I'm scrolling the questions as they're
Okay.
through. We're getting down there, guys. We're doing wonderful.
Okay.
One of the questions that I probably can just answer is, there was a question about if you missed a portion of this meeting, is there a link to rewatch any information? Who wants to take that one? That's a gimme.
Go. Sure. So yes, we are recording this presentation this evening, and it will be uploaded to our website for any family, parent, guardians who were unable to be with us today, or if there are audience members who were not able to be present at the start of the presentation and would like to watch it from the beginning, it will be available up on our website.
On our BOCES website, at the top, there's actually a red tab now that actually includes a lot of COVID reopening plans that has the plans that we submitted to the state ed department, to the state Department of Health, and this type of information will be posted there. So it should be easy for you to find. It probably will take 24 hours for it to be up there and available.
Thank you. The last batch of questions that I am identifying have to do with switching between remote and hybrid learning. The first question is, if a child that is attending has to change to remote learning for a short period of time because of illness or contact tracing reasons, while they are home, will the remote learning be with their class via Zoom or a different group of remote learners?
So I can speak to our programs here at the Ed Center. All of our classroom teachers in both our Oak Tree and PALS program are preparing instruction in the classroom to meet the needs of both our in-person and our remote learners simultaneously. And we're doing that because we know that it's a strong possibility at any point in time that a student can swiftly change between in-person instruction and the need to go to remote instruction for a variety of reasons, be it parent choice, be it illness, whatever the case may be. And we want to ensure that our system that we are up and running with allows for that quick and efficient flexibility for our students and their families so that there are no delays in instructional delivery for our students. So with that said, Broome-Tioga BOCES is utilizing 2 specific platforms for instruction, which include Seesaw for our earlier elementary age students, and also Google Classroom. And so our classroom teachers will be designing instruction for all students utilizing those platforms on a daily basis to allow for that efficient flexibility between remote and in-person learning.
Thank you. I think you addressed this piece, but just to answer it separately, will parents be able to choose between hybrid and in-person at any time?
Yes, for students with disabilities, the parents have a choice of the manner with which their student receives instruction under these conditions, and they can change their mind at any point between remote, hybrid, or in-person instruction.
Excellent. And the last question in our Q&A chat at this moment is in regards to missed therapy sessions that happened during the closure. What will happen with those?
Sure. Tammy, may you speak to that?
So the parent and BOCES will work with the district to come up with a plan and to determine what therapies will need to be made up and how they'll need to be made up. So I would suggest reaching out to your CSC at this point.
Thank you, Tammy.
And with that, the question and answers in the chat are clear at the moment. So if there's any last minute questions, please be sure to enter them now.
Just to comment again, our list of participants got up to 90-ish during this session, and we really appreciate that. I think, as I said at the beginning, if we work on this as a team, that's going to make us the most successful, and having the parental interest and involvement certainly is a great assistance to us and will help us do even better. So just because we're having a session today where questions and answers are happening doesn't mean it's the only opportunity for you to continue to provide us input and feedback, because at the end of the day, we want this to be successful. And we appreciate you taking the time out and participating to this session this afternoon.
Thank you. The last pieces to tie up have to do with, will a virtual walk-in visit be acceptable as an excuse to return to school?
So as long as you have a doctor's note, so virtual walk-in visits, they're still able to provide documentation. So as long as a doctor stated that someone is, to their assessment, they have diagnosed them with something other than COVID-19 and they're safe to return to school, then of course, whatever you know, whatever communication your doctor is giving you to present that, then yes.
Thank you. There's the question in the chat about, will there be 6 feet of distance between students, teachers, and aides? Is that possible in an 811 classroom?
Yes, it is. As I had stated, the measurements that were taken allowed for that social distancing spacing to be in place for staff and students in each classroom.
The final question is, if a student does not wear a mask, will they be subjected to code of conduct rule at the elementary school?
Could I take this one? So we recently had a parent meeting with other program areas, and a student who has the capability of wearing a mask and is just not wearing one because they want to violate the rule would be subject to discipline under the code of conduct, and we've updated our code of conduct to include that. We are not going to discipline a student who has a legitimate medical or mental health issue associated with their wearing of mask. That is going to take priority over everything. So we're distinguishing between the student who just chooses to not wear a mask because they want to make a statement versus a student who can't wear a mask for legitimate reasons, and a student will not be disciplined in those cases.
Vanessa, are there any other questions?
At this point, the group chat has taken all of the general questions, and programs can follow up with specific student-related questions. So yes, the chat is clear.
Okay. Thank you very much. Thank you to all of our panelists today and for all of the teamwork that went into putting this presentation together. We thank our parents and guardians for logging on and watching our presentation today. If you should ever have any follow-up questions or concerns, please reach out to your administrator, and we would be happy to get back to you as quickly as possible. Again, thank you very much, and we wish you and your student a happy, healthy, and safe return to the school year.